Husted is at the foot of Murkowski in terms of milking the clock. So now Senator Kaine.
Thank you, Mr. Chair, and to the chair and ranking. This is an important hearing, great witnesses, a lot of agreement about things we need to do, a sense of urgency about some things we should do very quickly, and then a commitment to look longer term at bigger solutions. Just to tell you the life of a senator, we get a lot of letters. Let me tell you about healthcare letters this year. Last year, in the period from the beginning of the year to the beginning of December 2024, I got 55,000 pieces of correspondence about healthcare last year. This year, in the same period, 140,000 pieces of correspondence about healthcare, almost triple. A few examples: a family in Crozet, Virginia, near Charlottesville, their marketplace plan premium will triple in price without the extension of the ACA subsidies. Glen Allen, Virginia, a couple that's a suburb of Richmond, their premiums will more than double from $940 a month to $2,200 a month without the extension of the ACA enhanced subsidies. And a gentleman from Lake Frederick, Virginia, in the northwestern part of the state, on fixed income, he'll be paying $2,600 a month if the enhanced subsidies expire. And this is just a small snapshot of the 150,000 pieces of correspondence. We missed an opportunity, and I just want to put this on the table. The reconciliation bill that was passed at the end of June gave tax cuts to people in the top 1% of American wealth, totaling $1 trillion over 10 years. We gave tax cuts to the top 1%, totaling $1 trillion over 10 years. What would it have cost for us to extend the premium tax subsidies? $350 billion. Not cheap, but one-third of the tax cut that we gave to the top 1% of people in this country who sure didn't need a tax cut. We could have given them $650 billion of a tax cut and extended the ACA subsidy, and that was not the choice, and that's one of the reasons why I voted against the reconciliation bill. We're talking about doing a short-term extension, possibly, of the tax credits, about $35 billion a year. So for 2 years, $70 billion up against $1 trillion of tax cuts to the wealthiest. We can do this. We should be able to do it. We should extend the enhanced tax credits for a period of time and then work on the ideas that are around the table. And now let me just focus on ideas. We want solutions that promote competition, that support small businesses, working class families, that are affordable, that don't pad the pockets of middlemen. I'm so frustrated with middlemen. I'm so frustrated with middlemen. I have two ideas that I want to put on the table for the longer term. Well, actually, one is for the longer term discussion. One could be short term. Senator Bennett and I are going to soon reintroduce our Medicare Choice Act, which would direct CMS to offer a nonprofit insurance plan covering the Obamacare essential health benefits. Medicare operates on an administrative cost of about 1% to 2%. It exists in every zip code in the United States. It doesn't have to pay fancy salaries. It doesn't have to market on TV. It doesn't have to do a return to shareholders or pad, people's pockets. A policy directed by CMS with premiums that would cover the cost of it, but the ability to use premium tax credits to bring the premium down even further would be such an attractive option. We don't want to have just one option available to everybody, so make a public option available. What's wrong? It would promote choice. It would promote competition, would bring down cost. I recognize this proposal would be one part of a long-term solution. It's different than the one that Senator Sanders is talking about. It shares some elements, but it's different. But these are the kinds of big ideas that we ought to be talking about as we're trying to find a long-term solution. And the second one, I think, is even short-term. We've already done it, PBM reform. This committee passed a fantastic bipartisan PBM reform bill a year ago, again, on the middleman theme. I don't like the consolidation of the insurance industry and that huge profit margin that jacks up everybody's costs. And I don't like pharmacy benefit managers who don't do any medical research, who don't produce any products. I don't like them charging based on a percentage of the drugs that they're sending out, which gives them an incentive to not focus on low-cost affordable drugs, but skew the market toward higher-cost drugs so that they'll make more money for basically doing nothing. And we passed this bill out of committee with like a 19-2 vote a year and a half ago. And it was almost taken up at the end of last year on the floor, but we sort of ran out of time. We should do that bill right now. That's kind of like in the Usted theory of let's hit some singles or some doubles on things where we agree. Would PBM reform be a good idea to the panel?
It's essential.
Essential.
Absolutely.
I agree. However, a one-size-fits-all does not solve the problem because there are great PBMs that do things the right way. We have a few that are the greedy middlemen. So yes, I do think PBM reform.
I'm glad that there's not only agreement here, but on the other side of the dais. Thanks.